Aliza Jaffer is a graduate of the Bachelor of Health Sciences program at the University of Calgary and a Chancellor Scholar alumna. She joined the Developmental Neuroimaging Lab at the Alberta Children's Hospital in 2021 as an undergraduate research student, working under the supervision of Dr. Catherine LaBelle and collaborating closely with Dr. Catherine Manning. Aliza's research uses magnetic resonance imaging to investigate brain function and behavior in infants exposed to prenatal distress. Currently, she is a second-year master's student in the Medical Sciences program, specializing in medical imaging, and has been a recipient of several research awards, including the first Canadian Institutes of Health Research Strategic Master's Award. She has also recently published her first author paper in the Journal of American Academy of Child and Adolescent Psychiatry. Aliza has presented her work in both local and international settings. She was selected for an oral talk at one of the largest medical imaging conferences held in London, England, and most recently presented her research at another major research conference hosted in Seoul, Korea, this past June. Beyond her research, Aliza is passionate about enhancing educational opportunities for students. As the Education Co-Director for the Alberta Children's Hospital Research Institute Trainee Association, she co-chaired the Institute's undergraduate research symposium and is actively involved in planning the upcoming trainee symposium in November. Additionally, she has organized educational outreach sessions for elementary students in Calgary Public Schools, inspiring young minds to explore the brain and fostering their enthusiasm for science. She is also an active member for the Graduate Scholar College and was recognized for both the second place finalist and the People's Choice winner for the 2024 3-minute thesis competition this past spring. Outside of her research, she can be found shooting hoops on the basketball court or training for her second triathlon. Incredible. Now, please help me welcome Aliza.
Thank you, Faith. Have you ever wondered how the very first moments of our lives shape who we become? Imagine for a moment a tiny seed planted in the most nurturing ground. This seed has the potential to grow into a robust tree, weathering storms and thriving through seasons. But what if, from the very beginning, this nurturing soil was shadowed, not by the physical clouds in the sky, but by the clouds of anxiety and depression? This is not just a story of a small seed, but a metaphor for the earliest stages of human development and the essence of my research. My project aims to understand how a mother's mental health during pregnancy influences the brain and behavioral development of their child. When people experience symptoms of anxiety and depression, the level of cortisol in their body, commonly known as the stress hormone, rises. In pregnant individuals, cortisol can cross the placenta and reach the developing fetus, having implications on the way their brains develop, which can translate to behavioral concerns later on, such as delayed communication. This is especially important as up to 1 in 5 pregnant individuals experience symptoms of anxiety or depression at any given point during pregnancy. This became especially worrisome during the COVID-19 pandemic, where rates of prenatal distress were found to be 3 to 4 times higher compared to pre-pandemic rates, raising concerns about what implications this will have on infant development, but also offering a unique opportunity to study these effects on the child brain. In my project, I leveraged a diverse Canada-wide data set with information from over 10,000 pregnant individuals and their infants during the pandemic. A subset of these infants obtained brain MRI scans at the Alberta Children's Hospital or BC Children's Hospital that I analyzed using advanced imaging software. This allowed me to observe patterns of brain network development across the first 2 years of life. I was particularly interested in the frontoparietal brain network, which involves a group of interconnected brain regions that work together to perform certain functions, such as memory, attention, and decision-making. I found that the developmental trajectories in infants whose mothers had high distress during pregnancy were actually quite similar to those who experienced low distress. In the graph, the high distress group is blue and the low distress group is in green. This may show promising results. However, I also found that infants exposed to higher maternal distress had worse behavior scores in the motor development, social interaction, and problem-solving domains, which then raises concerns later on in development as well. The results of the study can allow us to identify factors that may buffer these effects, such as increased social support from a partner during pregnancy. These results can also allow us to inform healthcare policy and practice by advocating for increased mental health screening during prenatal care visits. Implementing targeted interventions for these children to support their cognitive, emotional, and social development may also be beneficial. That being said, it is important to keep in mind that child development is quite diverse, and that children may respond uniquely to supports, depending on their individual needs, their experiences, and their genetic influences. Ultimately, I hope that my research can help to support healthy development of families, especially during times of elevated and prolonged distress, to ensure that regardless of the clouds above, all children, the seeds of our future, have the chance to flourish. Thank you.
Wonderful job, Aliza, on your presentation. Now to follow up with a few questions. Did you have the opportunity to scan your own participants for your study? And if so, how was that experience for you as a researcher?
Definitely, thank you, Faith. So most of the scans in the study that I described were obtained at the Alberta Children's Hospital in conjunction with a wonderful team of research assistants, lab technicians, nurses, graduate students, and volunteers. We also have collaborators at BC Children's Hospital where we have scanned some infants as well, and have future collaborations at institutes in Toronto and Montreal. So this is great news in terms of neuroimaging data for this study. As a researcher, I think it's very valuable to be involved in the data collection process because instead of just obtaining the scans and analyzing the data, I'm able to look at the intricacies in infant scanning and truly understand the time and the effort that's put into collecting this data. So ultimately, it really gives you a well-rounded understanding of the project and the data set.
Wow, that's amazing. And at what age did you begin scanning the infants in your study? And can you walk us through what this process was like?
Yeah, great question. So the youngest infants in the study were actually 3 months of age. So as you can imagine, they're quite small, but very, very cute. The process of scanning is quite meticulous, but essentially after the participant arrives at the hospital, we take them to the scanner, which at the Alberta Children's Hospital is set up to look like a spaceship. So it's very child friendly. And if you've ever been in one of the MRI machines before, it does make a lot of loud noises that kind of emulate that as well. And so the infant is then fed and put to sleep. This is natural sleep. We don't use sedation for this study. At this point, they're essentially gently wrapped in what looks like an inflatable blanket, and this helps them stay warm and still during the scan, and then they're fitted with ear protection as well. So at this point, we put them in the scanner and quite literally cross our fingers that they stay asleep, because this would help us obtain the best quality data with low motion. However, of course, this is not always the case, and sometimes the infant will wake up and we'll have to just go in, resettle them, and hope they fall asleep again to continue the scan. So that's definitely really cool. As well, I find it interesting that participants that are in the scanner can also obtain a copy of their brain scan, which is a nice memento to have as well.
And lastly, what do you enjoy most about your day-to-day work on this research?
Definitely, great question. I really enjoy learning how to use neuroimaging software and also new coding programs. But what I really value about this research work is that there's a balance between analyzing data and preparing for presentations and writing papers, but also being able to help with these infant scans and collaborate with some of the colleagues in our lab. I think research in general is quite collaborative, and whether that means, bouncing off new ideas off somebody or troubleshooting code or really just being there to support each other, it makes all the difference and makes this research a lot more enjoyable too.